Hello, I'm Dr. Robert Clark. Today, we need to have a serious conversation about two remarkable, hard-working organs that most of us ignore until it's far too late: your kidneys. And the statistics are truly startling. Over 37 million American adults are living with chronic kidney disease, and the vast majority, a shocking 9 out of 10, don't even know they have it. Why? Because kidney disease is a silent disease. It often has no symptoms in its early stages. Your kidneys are incredible compensators. They can lose up to 75, even 90% of their function before you feel that anything is wrong. By the time noticeable symptoms appear, the damage can be severe and often irreversible. Think of these early, subtle signs not as a nuisance, but as a crucial warning shot from your body. It's a message from deep within, pleading for you to pay attention before you reach a point of no return. Ignoring these whispers can lead to a full-blown crisis, dialysis, transplant, or worse. But it doesn't have to be that way. The good news is that your body does send signals. You just have to know how to listen. In our time together today, we are going to pull back the curtain on the 7 most common signs of kidney trouble that seniors in particular tend to dismiss as just another part of getting older. We'll learn to tell the difference between a normal age-related change and a critical red flag. Let's get started. One of the most direct messages your kidneys can send you is right there in the toilet bowl, yet it's one of the easiest to overlook. I'm talking about foamy urine. Many people see bubbles and think nothing of it, perhaps blaming a new toilet cleaner or just the force of their urine stream. But this can be a critical sign of a problem called proteinuria, which means there's excess protein in your urine. Let me tell you about a patient of mine, John, a 68-year-old retired history teacher. John was a sharp man, observant and thoughtful. He noticed for a few weeks that his urine seemed unusually foamy, almost like the head on a glass of beer. He mentioned it to his wife, who suggested it was the new cleaning tablets she'd put in the tank. It was a logical explanation, so he dismissed it. But months later, he came to see me for his annual checkup, feeling more tired than usual. When I asked him about any changes he'd noticed, he reluctantly brought up the foaminess, almost as an afterthought. That seemingly minor detail was the key that unlocked the real problem. A simple urine test confirmed he had significant protein leakage, an early but clear indicator that his kidneys, strained by years of undiagnosed high blood pressure, were beginning to fail. So, what is happening inside your body to cause this? Think of your kidneys as containing millions of tiny, incredibly sophisticated filtering units called glomeruli. Their job is to clean your blood, removing waste products while holding on to essential substances, like protein. Imagine a very fine kitchen sieve. You can pour sandy water through it, and the sieve will catch the sand while letting the clean water pass. Your glomeruli do the same thing with your blood. Protein molecules, like albumin, are large and shouldn't be able to pass through this fine filter. But when the glomeruli are damaged by high blood pressure, diabetes, or inflammation, the holes in the sieve become larger. This allows those big protein molecules to leak out of the blood and spill into your urine. When this protein-rich urine hits the toilet water and mixes with air, it acts much like egg whites when you whisk them. It creates a stable foam that doesn't easily dissipate. It's important to distinguish this from normal bubbles. A forceful urine stream can create bubbles, but they typically vanish within a minute or so. The foam from proteinuria is different. It's often described as being made of smaller, tighter bubbles, and it's persistent. You might flush the toilet and still find a ring of foam remaining. It often takes a second or even a third flush to completely clear the bowl. This is the practical, real-world sign to look for. If you see this day after day, it is not something to ignore. It is a direct visual clue that your body's vital filtration system may be compromised. So I want you to ask yourself 2 simple questions. First, have you recently noticed a consistent change in the appearance of your urine that lasts for more than a day or two? Second, Do you find yourself needing to flush multiple times to clear the bowl of a sudsy or foamy residue? Your answer could be the first step in protecting your kidney health for the long run. Let us move on to a symptom that many people feel in their shoes and see in their socks long before they connect it to their internal health: swelling in the feet, ankles, and legs. This condition, known medically as edema, is often brushed aside. We blame it on a long day of sitting, standing too much, a long car ride, or just the summer heat. But persistent swelling that you notice day after day can be a critical signal that your kidneys are struggling to maintain one of their most important jobs: fluid balance. I remember a lovely 72-year-old grandmother named Margaret who came to see me. She was worried because her favorite pair of walking shoes suddenly felt uncomfortably tight, and the straps on her sandals were digging into her feet. At the end of each day, when she took off her socks, she noticed deep, lingering indentations around her ankles. She initially thought it was just her circulation slowing down with age. It wasn't until her daughter, a nurse, visited and saw her swollen legs that she insisted Margaret come in for a checkup. Her daughter's concern was well-founded. Tests revealed that Margaret's kidneys were not filtering properly, causing significant fluid and sodium retention. To understand why this happens, we need to appreciate the elegant balancing act your kidneys perform 24 hours a day. They are the master regulators of the body's fluid levels. A primary function is to filter out excess sodium from your blood. As you may remember from high school science, where sodium goes, water follows. Healthy kidneys precisely control how much sodium to excrete into the urine, thereby controlling how much water your body retains. However, when kidney function declines, they lose this ability. They can no longer effectively remove the excess sodium. The sodium begins to accumulate in your bloodstream and tissues. Consequently, water is retained right along with it. Gravity then pulls this excess fluid down to the lowest parts of your body, causing the characteristic swelling in your feet, ankles, and sometimes even your hands or face. This isn't just a cosmetic issue. It's a sign that your body's entire internal environment is out of balance, placing extra strain on your heart and circulatory system. There is a very simple, practical test you can do at home if you suspect this type of swelling. It's called the pitting edema test. Gently but firmly press your thumb or finger into the swollen area, for instance, on top of your foot or along your shin bone, and hold it for about 5 seconds. When you release the pressure, look closely at the skin. If a distinct indentation or pit remains for a few moments before slowly filling back in, that's a clear sign of pitting edema. This indicates that there's enough excess fluid trapped in the tissue to be displaced by your finger. Normal swelling from a long day on your feet typically doesn't pit in this way. This simple test can be a powerful clue that the swelling you're experiencing is more than just a minor annoyance, it is a systemic issue that warrants a conversation with your doctor. So, take a moment to reflect on these 2 questions. Do your socks consistently leave deep, lasting marks on your ankles at the end of the day? And have you noticed that your shoes feel tighter than they used to, even if your weight hasn't changed? Don't dismiss these signs. Your body is telling you that its delicate fluid balance may be in jeopardy. One of the most common complaints I hear from my older patients is a profound sense of fatigue. They'll say, "Doctor, I just don't have the energy I used to. I feel completely worn out, no matter how much I sleep." It's so easy to attribute this to the natural process of aging, to the stresses of life, or to poor sleep. But a persistent, bone-deep exhaustion that isn't relieved by rest can be one of the most significant and misunderstood signs of declining kidney function. Let me tell you about Arthur, a 75-year-old retired carpenter who had always found joy in his workshop. He came to me because he had completely lost his passion for his hobby. He explained, "I go out to the shop, I look at the wood, and I just feel too tired to even pick up a tool. All I want to do is go back inside and sit in my chair." He had tried drinking more coffee, thinking it would give him a boost, but it just made him feel jittery and did nothing to touch the underlying exhaustion. He was convinced this was just his new reality of being 75. But it wasn't. After a thorough evaluation, we discovered his kidney function was significantly impaired, which was causing his debilitating fatigue in two distinct ways. The first and most straightforward reason is the buildup of toxins in the blood. As we've discussed, when your kidneys fail to filter waste products effectively, these impurities accumulate. This condition, known as uremia, can have a systemic effect on your body, slowing down various processes and leading to a general feeling of sluggishness and lethargy. Your body is essentially being weighed down by the waste it can no longer eliminate. However, there's a second, more powerful reason for this specific type of fatigue, and it has to do with your blood. Healthy kidneys produce a vital hormone called erythropoietin, or EPO for short. EPO sends a signal to your bone marrow, telling it to produce red blood cells. These red blood cells are the oxygen carriers for your entire body. They pick up oxygen from your lungs and deliver it to every cell, every muscle, and especially your brain. When your kidneys are damaged, they produce less EPO. With less EPO, your bone marrow gets a weaker signal and produces fewer red blood cells. This leads to a condition many of you have heard of: anemia. When you're anemic, your blood simply can't carry enough oxygen to meet your body's demands. This oxygen deprivation is what causes the profound, unshakable fatigue. Why coffee doesn't eat tea work, you don't have a caffeine problem, you have an oxygen delivery problem. The practical difference between this type of fatigue and normal tiredness is crucial to recognize. Normal tiredness usually has a clear cause, a poor night's sleep, a strenuous day, and is relieved by rest. You can take a nap and wake up feeling refreshed. The fatigue associated with kidney disease and anemia is different. It's a feeling of being completely drained, as if your internal battery is dead and won't hold a charge. Simple tasks that you used to do without a second thought, like carrying in the groceries or climbing a flight of stairs, can feel like climbing a mountain. It's often accompanied by feeling cold when others are comfortable, shortness of breath, and difficulty concentrating. So please ask yourself these two critical questions. Do you feel genuinely exhausted, even after what should have been a full and restful night of sleep? And have you given up activities you once enjoyed, not out of a lack of interest, but simply because you feel you lack the physical and mental energy to do them? This isn't just getting old. It is a systemic warning sign that your body is not getting the oxygen it needs to function, and your kidneys could be the root cause. Changes in your bathroom habits are intensely personal, and because they can happen gradually, we often normalize them as an inevitable part of aging. We might joke about knowing where every restroom is in town or about getting up multiple times a night. But significant and lasting changes in urination patterns, how often you go, how much you go, and what it looks like, can be a direct communication from your kidneys about their health. Consider the case of Helen, a 65-year-old woman who came to see me at her family's insistence. She had started waking up 3, sometimes 4 times every single night to use the bathroom. She was exhausted from the interrupted sleep but had accepted it as her new normal. "My mother did it. My grandmother did it. I just figured it was my turn," she told me. She assumed she had a weak bladder and was even considering medication for it. During the day, she also felt a constant, nagging urge to urinate, even if very little came out. It turned out not to be a bladder issue at all. Her kidneys had lost their ability to concentrate urine, a hallmark of chronic kidney disease. Let's delve into the science of what's happening. Healthy kidneys are masters of efficiency. One of their most amazing feats is concentrating urine. Think about it. You might drink 2 liters of water a day, but you certainly don't urinate 2 liters of fluid every few hours. Your kidneys filter a massive amount of blood, about 180 liters every day, but they reabsorb almost all of the water back into the body, concentrating the waste products into a much smaller volume of urine. This process is managed by the kidney's tubules. When these tubules become damaged, they lose their ability to effectively reabsorb water. As a result, your body starts producing larger volumes of dilute, watery urine. This is why you have to go to the bathroom more frequently, especially at night. During the day, gravity and movement help manage fluid, but when you lie down to sleep, the fluid that may have been pooling in your legs re-enters your bloodstream, gets sent to the kidneys, and since they can't concentrate it, it quickly fills your bladder, waking you up. This condition is called nocturia, and while it can have other causes, it's a classic sign of kidney distress. Beyond frequency, the appearance and feel of urination are also key. The practical clues are right in front of you. Is your urine consistently very pale and clear, almost like water? This could indicate it's not being concentrated properly. Conversely, is it darker than usual, tea-colored, or even reddish? This could signal dehydration or, more alarmingly, the presence of blood, which is never normal and always requires investigation. Another pattern to watch for is a change in flow. Some people with kidney problems experience a feeling of pressure or a need to go, but then have difficulty starting the stream or feel that they can't fully empty their bladder. While this can also be a sign of prostate issues in men, it should always be evaluated in the context of overall kidney health. I want you to pause and reflect on these questions. Has the number of times you get up at night to use the restroom disrupted your sleep on a regular basis? And beyond just frequency, have you noticed any persistent changes in the color, clarity, or amount of your urine? Answering these honestly could point you toward a conversation with your doctor that protects your health in the long term. Imagine sitting down to your favorite meal, a perfectly cooked steak or a fresh piece of fish, and taking a bite only to be met with a harsh, metallic taste, as if you were chewing on aluminum foil. Imagine your morning coffee suddenly tasting bitter and unpalatable. This disturbing change in your sense of taste is a lesser-known but deeply impactful sign of advanced kidney disease. It's not just an unpleasant experience, it can lead to a dangerous spiral of appetite loss, malnutrition, and weight loss, further weakening a body that is already under stress. I had a patient, David, a 70-year-old retired chef who lived for food. His greatest joy was cooking for his family. He came to me, distressed, because everything he ate tasted like licking a handful of old pennies. Food had lost all its appeal. He had no appetite, felt nauseated after meals, and had unintentionally lost over 15 pounds. He was worried he had some form of cancer. While we always have to rule out such possibilities, the culprit in David's case was severe uremia from end-stage kidney failure. The waste products in his blood were literally poisoning his sense of taste. The scientific explanation for this phenomenon is a direct consequence of the term uremia, which literally means urine in the blood. When your kidneys are failing, they can no longer effectively filter out waste products, chief among them a compound called urea. As urea levels build up to toxic concentrations in your bloodstream, your body tries to get rid of it through any means possible. Some of it is excreted through your saliva. Once in your mouth, enzymes in your saliva can break down the urea into ammonia. It is this ammonia that causes the unpleasant metallic or ammonia-like taste in your mouth, a condition known as dysgeusia. This same process can also lead to persistently bad breath that has a distinct ammonia or fishy odor, sometimes referred to as uremic fetor. No amount of toothbrushing or mouthwash can get rid of it. Because the problem isn't originating in your mouth, it is a systemic issue stemming from your blood. The real-world, practical impact of this is profound. It's not just about food tasting bad, it fundamentally changes your relationship with eating. When every meal is an unpleasant experience, you naturally begin to eat less. This is particularly dangerous for seniors who may already be struggling with maintaining muscle mass and adequate nutrition. The resulting poor appetite, nausea, and unintended weight loss create a vicious cycle. Your body becomes deprived of the protein and calories it needs to maintain strength and fight illness, which can accelerate the decline in your overall health and make you less resilient to the challenges of kidney disease. It's a devastating symptom for anyone, but especially for someone like David, whose entire life and social connections revolved around the joy of food. So I want you to consider these questions carefully. Has your sense of taste changed significantly, making foods you once loved seem unappealing or just plain wrong? Do you, or has a loved one, commented on a persistent, unpleasant taste in your mouth or bad breath that doesn't seem to be related to dental hygiene? This is more than a minor inconvenience. It can be a sign that toxin levels in your blood have reached a critical point. Of all the symptoms of kidney disease, perhaps one of the most maddening and distressing is a persistent, deep-seated itch that you just can't seem to satisfy. This isn't the familiar itch of a mosquito bite or a dry patch of skin. It's a relentless, generalized itching, known as uremic pruritus, that can feel like it's coming from deep beneath your skin. It can be so severe that it disrupts sleep, causes constant discomfort, and dramatically impacts a person's quality of life. Yet often there is no visible rash, leaving both the patient and sometimes their doctor confused. Let me tell you about Susan, a 69-year-old retired librarian. She came to my office in a state of absolute desperation. For months, she had been tormented by an intense itch, primarily on her back, chest, and arms. She had tried every cream, lotion, and oatmeal bath on the market with no relief. Her dermatologist was stumped because her skin looked perfectly normal. She told me, with tears in her eyes, that she felt like she was going crazy. She was scratching herself raw in her sleep, and the constant discomfort was making her irritable and depressed. Susan wasn't going crazy. Her body was sending a desperate signal that her internal mineral balance was dangerously off-kilter due to failing kidneys. To understand this severe itch, we need to look at another one of the kidney's crucial, behind-the-scenes jobs: mineral regulation. Your kidneys are responsible for maintaining a delicate balance of minerals in your blood, particularly phosphorus and calcium. You get phosphorus from your diet in foods like dairy, nuts, and meats. Healthy kidneys filter out any excess phosphorus and excrete it in the urine. However, when kidney function declines, they can no longer get rid of this excess phosphorus efficiently. As a result, phosphorus levels in the blood begin to rise. This high level of phosphorus sets off a complex chain reaction in the body. It can bind with calcium in the blood, pulling it out of circulation. This, in turn, can stimulate the parathyroid glands in your neck to release a hormone that leaches even more calcium from your bones to compensate. The end result is a chaotic state where you have high levels of both calcium and phosphorus circulating in your blood. These minerals can then form tiny crystals that get deposited in the soft tissues throughout your body, including your skin. It is believed that these microscopic deposits, along with the inflammation and nerve irritation they cause, are a primary driver of the intense, unrelenting itch of uremic pruritus. The practical experience of this itch is what makes it so distinct. Unlike a topical rash, it's often widespread and symmetrical, affecting large areas of the body. It tends to be worse at night, which is why it so profoundly disrupts sleep. Patients often describe it as a crawling, burning, or pins and needles sensation that no amount of scratching can relieve. In fact, scratching often makes it worse, leading to skin damage and potential infections without ever touching the root cause of the sensation. It is an internal problem manifesting on the outside. So please take a moment to ask yourself these important questions. Have you been experiencing a persistent and widespread itch that isn't relieved by typical moisturizers or allergy creams? And is this itching sensation not associated with any visible rash, bite, or other obvious skin condition? If so, do not dismiss it. This could be your body's way of telling you that your internal chemistry is out of balance and your kidneys are struggling to do their vital job of keeping it in check. We've talked about how kidney disease can affect your body from your urine to your skin, but its reach can extend even into the core of your being, your mind. One of the most frightening and disorienting symptoms is the development of brain fog, a persistent difficulty with concentration, memory, and clear thinking. When this happens, it's very common for both patients and their families to jump to the conclusion that it must be the early stages of dementia or Alzheimer's disease. While those are always important considerations in an older adult, It's absolutely critical to recognize that cognitive changes can be a direct result of toxic buildup from failing kidneys. I think of Robert, a 78-year-old retired accountant who had always been known for his sharp mind and meticulous attention to detail. His family brought him to me because they were deeply concerned. Robert, who once did complex tax returns for fun, was now struggling to follow the plot of a TV show. He was forgetting appointments, losing his train of thought mid-sentence, and seemed increasingly confused and apathetic. His wife was terrified, convinced it was Alzheimer's. After a comprehensive workup, we found that the true culprit was end-stage renal disease. The toxins his kidneys could no longer filter were clouding his mind. The science behind this is a direct extension of the uremia we've discussed. The same waste products, like urea, that cause a metallic taste and fatigue, can also have a profound impact on your central nervous system. These uremic toxins can cross the highly selective blood-brain barrier, which is meant to protect your brain from harmful substances. Once inside, they can disrupt normal neurotransmitter function, increase inflammation, and interfere with the brain's energy metabolism. In essence, the brain is being bathed in a low-grade poison, which impairs its ability to function correctly. This condition is known as uremic encephalopathy, and it can range from mild brain fog to severe confusion, lethargy, and, in the worst cases, seizures or coma. The good news is that unlike many forms of dementia, this cognitive decline is often reversible. When the underlying kidney disease is treated, typically with dialysis which artificially filters the blood, many patients experience a remarkable clearing of their mental fog. Robert, for instance, after starting treatment, was once again able to engage in conversations and enjoy his crossword puzzles. It's vital to be able to distinguish this from what we might call normal age-related memory lapses. Everyone forgets where they put their keys from time to time or struggles for a name. That's part of being human. The brain fog from uremia is more pervasive and impactful. It's not just forgetting a fact, it's a fundamental difficulty in processing information. It's a feeling of being mentally slow or cloudy. You might find yourself reading the same page of a book over and over because you can't retain the information. Balancing a checkbook or following a recipe, tasks that were once routine, can suddenly feel overwhelming and complex. It's a qualitative shift in your ability to think clearly. So I urge you to reflect on these questions, for yourself or for a loved one. Have you felt a persistent mental haze that makes it difficult to concentrate on everyday tasks? And have you, or your family, noticed a decline in your ability to solve problems or follow complex conversations that goes beyond simple, occasional forgetfulness? Don't automatically assume the worst. It could be a critical sign that your kidneys need immediate medical attention. We have journeyed through 7 subtle but serious signs that your kidneys might be in trouble: foamy urine, swollen ankles, persistent fatigue, changes in urination, a metallic taste, unrelenting itching, and cognitive brain fog. Seeing these signs can be frightening, I know, but I want to leave you with a message not of fear, but of empowerment. You are not helpless. Recognizing these symptoms early is the single most powerful thing you can do to change the course of kidney disease. Knowledge is your greatest ally, and now you have the knowledge to listen to what your body is trying to tell you. The good news is that diagnosing potential kidney problems is not complicated. It doesn't require invasive or expensive procedures. The next time you see your primary care doctor, you can be your own best advocate by specifically requesting 2 simple, routine tests. The first is a blood test to check your creatinine level. Creatinine is a waste product from muscle activity. Your doctor will use your creatinine level, along with your age, sex, and other factors, to calculate your glomerular filtration rate, or GFR. The GFR is the single best indicator of your kidney function. Think of it as a percentage score for your kidneys. A GFR of 90 or above is considered normal. A GFR that is consistently below 60 is a sign of chronic kidney disease. It's a clear, simple number that tells you exactly how well your filters are working. The second test is a urine test called a urine albumin to creatinine ratio, or UACR. This test checks for that protein leak we talked about in the very beginning, the one that causes foamy urine. It's a much more sensitive way of detecting kidney damage, sometimes even before your GFR starts to decline. Together, these two tests provide a comprehensive picture of your kidney health. So, what do you do with this information? If your tests come back and your GFR is below 60, or if you have a significant amount of albumin in your urine, this is the time for action. This is when you and your doctor should discuss a referral to a nephrologist. A nephrologist is a kidney specialist. They are the experts who can help you manage your condition, slow down the progression of the disease, and protect your remaining kidney function through diet, medication to control blood pressure and blood sugar, and other lifestyle modifications. Early intervention is everything. Catching kidney disease in its earlier stages gives you the best possible chance to preserve your health and avoid the most serious complications like dialysis or a transplant. I've created a simple checklist of the 7 signs we discussed today that you can download and take with you to your next doctor EUS appointment. It's linked in the description below. Please use it, start the conversation, and be sure to subscribe to this channel, as we're beginning a new series dedicated to proactive steps you can take to protect your kidneys for a long and healthy life. Your health is in your hands. Thank you for your time.